Hey guys, welcome to my YouTube channel. Today we are going to discuss about a very basic, simple and first bone of forelimb, that is scapula. First of all, we should know that there are two surfaces of scapula. This is the lateral surface and this is the medial surface of scapula. Let's say you are putting your hand on the body of animal. The surface which faces towards your hand is the lateral one. The surface which is facing towards the body of animal is the medial one. Let's discuss about lateral surface first. So here there are three borders of scapula. This is the vertebral border which is facing towards the vertebra of animal. This is the anterior border towards the mouth of animal. This is the posterior border towards the tail of the animal. Now here three angles are formed. The angle between anterior border and vertebral border is known as anterior angle, and the angle between the vertebral border and posterior border is the posterior angle. The angle between the anterior border and posterior border is the glenoidal angle of the scapula. Next, there is the scapular spine. The scapular spine runs and it ends as the acromion process. Here, which we can see, this is the acromion process and it contains a tubercle-like structure. This is known as tuber spine. Now there are two depressions. One is before the scapular spine and another is after the scapular spine. The depression before the scapular spine or towards the anterior border is the supraspinous fossa. The depression towards the posterior border and behind the scapular spine is the infraspinous fossa. And the anterior border ends as a supraglenoidal tubercle. There is a glenoidal cavity and this tubercle is lying just before and above to the glenoidal cavity, so this is known as supraglenoidal tubercle. It is also known as tuber scapulae. Now let's move to the medial surface. The anterior border ending as supraglenoidal tubercle or tuber scapulae. Here this small process is known as coracoid process. Between the supraglenoidal tubercle and glenoidal cavity, here there may be presence of glenoidal notch. This notch-like structure, it is known as glenoidal notch. This one is the anterior border, this is the posterior, and as we know that this is the vertebral border of scapula. Now on the medial surface of scapula, this is known as subscapular fossa. Over here we can see some rough area. This is for the attachment of serratus ventralis muscle, and in the subscapular fossa there is an attachment of subscapularis muscles. And this is the glenoid cavity. This is the glenoid notch. This is the choroid process, and above this we can see the supraglenoidal tubercle, which is visible in the lateral or medial view of the scapula. So now let's summarize what we have discussed so far. This is the vertebral border of scapula, anterior border of scapula, posterior border of scapula. Anterior border and vertebral border form the anterior angle. Vertebral border and posterior border form the posterior angle. Anterior border and posterior border forms the glenoidal angle on the scapula. And here it is the scapular spine. It contains a tubercular structure which is known as tuber spine. The scapular spine ends as acromion process, and the anterior border here ends as supraglenoidal tubercle, or we can say tuber scapulae. It is known as supraglenoidal tubercle because it lies just above and anterior to the glenoidal cavity. Now just anterior to the scapular spine, it is the supraspinous fossa, and just posterior to the scapular spine, it is the infraspinous fossa. They both are depressions just before and after the scapular spine. Moving to the medial part. On medial surface there is a subscapularis fossa. Here it is the rough area for the attachment of serratus ventralis muscles, and anterior border ends as a small process that is known as coracoid process, where glenoid notch may be present. This is the glenoidal cavity, this is the glenoidal notch, this is the coracoid process that is over here. So this is all about scapula. Stay tuned for watching more such videos.